Hi everyone, Dinesh Sarasena here, and today we're going to be talking about injections to the lateral elbow. As mentioned in my previous video about imaging the lateral elbow, I tend to have the patient either seated upright with the arm resting on top of the examination couch and it's slightly flexed, or I tend to have the patient lying supine with the arm again in a slightly flexed position and the hand resting against their leg. This latter position is more comfortable for the patient and they tend to be more stable. And it also means that your images will be more stable as well. So there are various things that you can inject when you're injecting the lateral elbow. It can be the tendon, it can be the ligament, or it can be the joint. This can be done in either an in-plane or out-of-plane injection. Here we're seeing the transducer in a longitudinal axis over the forearm, and the needle is inserted from a distal to proximal orientation. The needle is aimed at either the common extensor origin, such as for PRP injections. It can be aimed at the radial collateral ligament, such as for prolotherapy injections, or it can be aimed at the joint line. And again, you could try PRP or steroid injections. And here's what you will see. So the needle can be directed at the common extensor origin, the radial collateral ligament or the lateral collateral ligament, or the lateral joint line. You can also undertake injections to the lateral joint line using an out-of-plane approach. For this, you need to place the transducer over the joint line and you insert the needle perpendicular to the skin as close to the transducer as possible. And basically, you direct the needle directly into the joint line itself. The advantage of this is that there's a lot shorter space or a lot less tissue to traverse to get into the joint line, and it may be more comfortable for the patient than using an in-plane approach. And here is what I'm talking about. We have the transducer over the lateral joint line, and ideally we place the lateral joint line in the center of our image. You then introduce the needle perpendicular to the skin and directly down into the joint line itself. Thanks for watching. I hope you found the video useful and it adds to your knowledge of musculoskeletal imaging. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram. Also, remember to check out sportsmedinfo.sg. I hope to see you all very soon.